Okay, welcome to this webinar, part of a seminar series called Public Health Voices, which is open to all across UCL, and we aim to engage with and showcase the importance of interdisciplinarity in public health research. So this is the inaugural event, and it's a chance to explore the incredibly important subject of climate change, health, and justice. Now, we all know that climate change is an enormous threat to all of us, and particularly to health, and it has a disproportionate impact on poor communities, particularly communities in the global south, but every region in the world is affected. And it's also a huge opportunity to improve health through actions to reduce greenhouse gas emissions, which are pretty well everything you do to reduce climate change is good for your health. We first got involved with the Lancet Commission back in 2009, managing the health effects of climate change. And since then, there have been many significant research programs and publications. Now, we're going to focus also on the COP today, the Conference of the Parties 27, which has just finished. That's where heads of state, ministers, and negotiators, along with climate activists, academics, mayors, civil society representatives, and CEOs meet together. They did in Egypt this year at the 27th conference. It's the largest annual gathering on climate action. And of course, academic institutions such as UCL play an important part and a critical role in trying to influence decision makers to implement effective policies, not always with success. So today we've got two real experts from the UCL Faculty of Population Health Sciences who both went to COP as part of the UCL delegation. And they're going to talk about what it meant to them and what they found. The first is Marina Romanello, who probably needs no introduction. Dr. Marina Romanello is a climate change and health expert. She's executive director of the Lancet Countdown. And the second speaker is Mita Huck, who did our master's course about 2 or 3 years ago, and she's now a researcher at the UCL Institute for Global Health and a promoter of climate and health justice. Both are going to speak for about 15 minutes, and then when that's over, we will have questions. If you want to ask questions, just go to the Slido link, which will be available in the chat. And you can ask questions. We've already had some. And then we will finish promptly at 5 because that's the end of the day. So I'm going to hand over straight away to Dr. Marina Romanello, Executive Director of the Lancet Countdown, for her presentation on climate change and health. Marina, welcome.
Thank you, Anthony, so much. And thank you, everyone, for being here. I'm delighted to share with you some of the work that we've been doing at UCL on climate change and health within the Lancet Countdown collaboration, and some of the initial reactions of COP. As Anthony said, we've been there at COP and we just came back a bit bruised, a bit scarred, but still here and still up to dealing with this greatest health issue of the 21st century. So I hope you can all see my screen now. I'm going to present to you some of the findings of our latest Lancet Countdown report, whose title is Health at the Mercy of Fossil Fuels. And I think after what happened at COP, this has become so much more relevant. So as a very, very quick overview, and I don't expect anyone to fully follow the many arrows in this graph, we know that climate change is impacting already today on our health through many different pathways. It's starting to affect us directly through direct exposure to extreme weather events. It's also starting to undermine the natural systems that our good health depends on, our capacity to grow our food, our exposure to infectious diseases, the quality of the air we breathe and the water we drink. And it's also undermining the socioeconomic determinants of health. But one thing that is really important that Anthony mentioned is that we also know that most of the actions that we need to take in order to tackle climate change translate directly into very sensible and very effective public health interventions that could improve our overall health outcomes, including providing cleaner air, reducing mortality associated with unhealthy diets, making our cities more livable, greener, healthier, and allowing us to have more sustainable, healthier lifestyles. So I'm going to present to you, as I said, some of the work that we do at Lancet Countdown. The Lancet Countdown collaboration is a big collaboration that has been publishing annual reports for the past 7 years in the medical journal, The Lancet, with the purpose of tracking, since the year the Paris Agreement was signed, the extent to which the impacts of climate change on health are changing, and the extent to which the actions that we take to deliver against the Paris Agreement are providing the health benefits that we hoped for. And we do so in the form of over 40 indicators, monitoring health impacts, adaptation, mitigation actions, and the health co-benefits of those mitigation actions, the transition in the economic sector, and the extent to which our politicians, society as a whole, scientists, and media are understanding that climate change is fundamentally a health issue. So the Lancet Countdown, as I said, is a big international research collaboration. It is based here at UCL in the Institute for Global Health and was funded by Anthony Costello and Hugh Montgomery mainly a few years ago. And it has close partnerships with leading institutions around the world. I'm showing you the institutions that contribute to our global report. We have almost 100 institutions that contribute also to regional Lancet Countdown reports every year. And importantly, we partner closely with the World Health Organization that obviously has taken a very important role in the latest years also in exposing the links between climate change and health. So the findings of our latest report, as I said, have become ever so important, increasingly after the COP negotiations. We're seeing that we're under a persistent fossil fuel addiction. This addiction is not only exacerbating climate change and, as a result, the health impacts of climate change, but also now interacting with other crises that we're facing, including the energy crisis, the cost of living crisis, the food crisis, and still the COVID-19 pandemic, to undermine our capacity to cope with these other health shocks and exacerbating their negative outcomes on our health. I won't go into much detail on the many health impacts that we're seeing from climate change through our data, but just to show you some of the results, we're seeing that vulnerable populations are being increasingly exposed to days of heat wave that put their life at risk. They can lead to heat stroke, which is a medical emergency, also to acute kidney injury, to adverse pregnancy outcomes, and to mental health impacts. And heat wave exposure is increasing around the world. We're also seeing that our labor capacity is increasingly undermined by the higher temperatures. We know that it's really difficult to work under extreme heat, and that limits our labor capacity. And the reason why this is concerning is twofold. One, that it reduces people's incomes, therefore undermining the socioeconomic determinants that good health depends on. But also, it undermines working capacity, particularly in the agricultural sector, that are the sectors that you see here in teal color. Agricultural workers are very exposed to the elements, and what that means is that it poses a threat to our agricultural productivity and therefore our food security. For the first time this year, we're also monitoring food insecurity associated with the increase in heat wave events. And we're seeing that about 100 million more people reported suffering from food insecurity, not being able to access the food they need as a result of the increasing heat wave days. We're also seeing extreme weather events becoming more and more lethal, exposure of populations to wildfire danger increasing in almost every country, and the environmental suitability for the transmission of infectious diseases also increasing for diseases like dengue, chikungunya, Zika, babesiosis, malaria, and cholera. So we're seeing climate change starting to exacerbate the risks to our health worldwide. And we're particularly seeing that the most vulnerable countries with lower levels of Human Development Index, or HDI, are disproportionately affected. So a big problem of inequity underlines the whole climate change conversation. But besides the impacts of climate change on our health, we're seeing that the fossil fuel addiction is also affecting our health directly. The adoption of renewable energies has been shamefully delayed over the past years. And what that means is that millions around the world are still dependent on dirty fuels and using dirty fuels inside their homes, including fossil fuels and also biomass. About 48% of rural populations alone have access to clean fuels and technologies for cooking, meaning that 52% of all of the rural population are still using dirty fuels for cooking, and something very similar happens with heating and with lighting. We can see very big rural-urban divide in the access to clean energies for cooking. And we're also seeing, when we look at countries divided by their Human Development Index, that the countries with the lower levels of Human Development Index, generally very vulnerable countries with lower resources, are still highly dependent on dirty fuels in the domestic sector. And this means that people are being exposed to dirty air inside their homes. For the first time this year, we analyzed the indoor air in the homes of people in 62 countries. And we found that the air that they are breathing inside their homes exceeds the level of PM 2.5 air pollution, the very, very dangerous form of air pollution, by 30 times the safe WHO threshold. So they're breathing air that exceeds by 30 times the levels of PM 2.5 recommended by the WHO. This will have enormous burden of disease, particularly affecting respiratory health, cardiovascular health, and with long-term impact on chronic diseases, particularly affecting children as well. Now, with the energy crisis, the risk is that people are more and more turning to the use of dirty fuels inside their homes. And we're seeing that happening even here in the UK. The access to clean energies is being undermined due to the high energy costs. And this is a consequence of our slow adoption of clean energies, and our overdependence on fossil fuel markets that we have seen this year are so volatile, are so subject to geopolitical interests, and get people very dependent on markets that they have no control over. And with the increased health impacts of climate change and with the enormous burden of disease that comes with the burning of fossil fuels and the exposure to the associated air pollution, what we're seeing is that pressure on our health systems is rising and will continue to rise. That is why adaptation in healthcare is so important, and particularly strengthening our health systems. However, we're looking here at the adoption and the implementation of the health emergency management capacities that are mandated under the international health regulations. These are capacities that the international health regulations mandate, and supposedly they would help countries deal with public health emergencies, particularly infectious disease outbreaks. Now, the effectiveness of the IHR regulations have been put at question during COVID-19, but still they reflect what the health sector is being recommended to implement to strengthen and build resilience to these health shocks. And what we're seeing is that only 63% of countries reported high to very high level of implementation of their health emergency management capacities. And perhaps the most telling thing, if you look at this graph, is that countries with very high level of Human Development Index have much higher levels of implementation of the health emergency management capacities. That's countries with low and medium level of Human Development Index. This again shows us that the most vulnerable countries are left behind in the adoption of adaptation interventions and the strengthening of their health system, leaving them increasingly vulnerable to the health shocks of climate change. So there is where we have some good news from COP27 this year. COP27 for the first time established a very long overview of funding arrangements to address loss and damage. These are the impacts that countries are suffering because of climate change. And for the first time, we have the so-called developed countries acknowledging that they need to provide funds to the so-called developing countries to enable them to reduce, cope, and importantly, address the loss and damage related to climate change, which include the health impacts of climate change. It also, for the first time, acknowledges the obligations towards the right to a clean, healthy, and sustainable environment, and also acknowledges the right to health. It calls for transformation of the financial system, so important to support countries in a just transition, and emphasizes the need for financial support to so-called developing countries. It also agreed on developing a framework to define what a global goal on adaptation is and how to measure progress against it. And importantly, that framework will look at health as a key theme. So health will be contemplated in climate change adaptation, hugely important. And it also put a lot of emphasis in the role of youth, of indigenous peoples, of women, and also in the essential role of education, a just transition, and lifestyle change. So some wins from COP27 on that arena. However, what we're seeing is that governments and companies are still prioritizing fossil fuels over people's health. When we look at the energy system is the single largest contributor to greenhouse gas emissions. And what we're seeing, looking at the carbon intensity of the energy system, which means the amount of greenhouse gas emissions that we produce for each unit of energy that we generate, the carbon intensity of the energy system has globally stayed practically static since the 90s. And since the year that we adopted the United Nations Framework Convention of Climate Change, where we agreed to avoid dangerous anthropogenic interference with the climate system, we have decarbonized our energy system by less than 1%. And what is important is that at the same time, we've increased our energy consumption. And what that resulted in is our energy-related emissions having reached record levels in 2021 and then again in 2022. So we're not only not decarbonizing our energy sector, but we're actually moving in the wrong direction, increasing our emissions year on year. And we have some ideas of why that might be. We looked at 86 countries that contribute to about 90% of all global greenhouse gas emissions. And what we found is that 80% of those countries, taking into account all of the carbon prices that they introduce and the taxes on greenhouse gas emissions, and all of the subsidies on greenhouse gas emissions and fossil fuels, still 80% provide net subsidies to fossil fuels. They are financially incentivizing and paying for fossil fuel burning, artificially reducing the cost of fossil fuels and enhancing their consumption. And the total funds that they allocated to fossil fuel burning amounted to $400 billion, which is in many times more than they allocate to their total health budgets. And this is important in the light of a delay in the provision of $100 billion that countries committed to in 2009 to support the so-called developing countries in a just transition. So we cannot find $100 billion a year to support developing countries to transition to healthy low carbon systems, but we allocate $400 billion annually to promoting the burning of health-harming fossil fuels. And looking at the fossil fuel sector, the current strategies of the largest oil and gas companies, the investments they're doing today and the assets they hold today will lead them to exceeding in 2040 by over 100% the level of emissions compatible with the Paris Agreement. So fossil fuel companies are making plans and strategies today that will make it impossible for us to meet the Paris Agreement. And again, here, looking at COP27, we have concerning findings. We're seeing that ambition on decarbonization and mitigation was not increased from Glasgow, and actually countries had to fight really hard to keep at least the level of ambition from Glasgow. We're still seeing that fossil fuels are not mentioned in the need to decarbonize. We're seeing that we're only mentioning the phase down, not out, down, of unabated coal power, not all coal power, and only coal, not other fossil fuels. We're also seeing inefficient fossil fuel subsidies being mentioned, only inefficient ones, and we don't have a definition for what inefficient means. And we're also seeing that they're calling for low emission energy to be increased, and low emission can mean gas. And this was a result of pressure from oil and gas exporting countries. So again, the fossil fuel interests are being put before and to the detriment of people's health. So I will just close with this slide to give you some take-home message. We're today at a critical juncture where countries are trying to respond to an energy crisis and at the same time facing other simultaneous crises, including climate change. So it's important now to note that we can have an aligned response that allows us to tackle the simultaneous crisis at the same time. Through a health-centered response, we can increase our adoption and access to renewable energies, therefore reducing energy poverty. That could not only help clean the air inside people's homes, but also save over 1.2 million deaths from exposure to outdoor air pollution that come from fossil fuels. We could build better, more livable cities, greener cities, where we can have better exposure to green space that has enormous health benefits. We could also transition to healthier diets, and that could save 11.5 million deaths every year. And we can have healthier, more resilient public health systems So today, as countries devise responses to the energy crisis, we have an opportunity to increase our renewable energy generation and tackle both the climate crisis and the energy crisis at once. So with that, I'll just close and pass over to Anthony.
Marina, thank you. And thank you for sticking to time. That's absolutely great. If anyone's interested, the report that her presentation just shows a snippet of is the Lancet Annual Countdown. If you go onto the Lancet Countdown 2022, you can download it for free. And there are 44 indicators there. It's produced by 100 institutions around the world. So it's a really good report. And there's a lot of information there. And there are infographics as well on the Lancet website. So do have a look at that. I'm going to go straight on to the next speaker, Mita Huck from the Institute for Global Health. And she's going to talk about climate and health justice. Over to you, Mita.
Thank you. Let me just figure out how to make this work. Okay, can everybody see
that's
this?
great. That works.
This works? Great. Okay, so I'm here to talk about climate justice. More specifically, just reflecting on me and my team's experience talking about climate and health justice at COP27. So my name is Mita. I'd like to, before I start, I'd like to express some thanks to some key supporters, including the UCL COP27 committee, organizing committee, including Joanna, Becca, Chiara, and now knowing Anthony had reviewed my application. Thank you for supporting me to go into COP. It's been a really transformative experience, and it was my first COP. Thank you to our funders at Welcome and my team at Race and Health and the Envisioning Environmental Equity Collaborative. And most importantly, the communities who have shared their stories with our collaborators and kind of embodied the heart of this work. All right, so again, my name is Mita. I work at the Institute of Global Health and Race and Health. I primarily work on the Envisioning Environmental Equity Project, which I'll refer to as EEE from here on out. It's a multifaceted international project that aims to imbue the climate and health justice movement with anti-racist and anti-colonial approaches. This is really relevant in the public health space because health is so transdisciplinary. And so we do this in a number of ways. We talk about films, so we're making films, we're generating some research, we're making a podcast, we're creating education materials on climate and health justice, and we're making comic books. So this particular presentation is going to be full of colorful images straight from our comic books, which will be released very shortly and will be on our website, which I'll share with you later if you'd like. So I just want to kind of give a shout out to our project partners, including the University of Sao Paulo, Climate Operation in Uganda, and Youth Advocates for Climate Action in the Philippines. Together, we've been developing this body of work to share at COP27. We are a group of young climate and health passionate individuals, some of which are climate activists, some of which are educators. And what we really want to do is share MAPA stories at COP27. And when I say MAPA, I mean the most affected peoples and areas of climate change. Climate change does not impact us equally, meaning the health impacts of climate change are disproportionately burdened by minoritized communities around the world, with emphasis on minoritized communities in MAPA communities. For youth from minoritized MAPA communities, their futures are not only burning up in front of them, but their physical and emotional capacity to respond to this burning are also threatened. Health is not momentary, it is across the life course, and it is across your generations. So if there are a disproportionate number of bodies whose futures and generations are being impacted by climate change, then justice has to take center stage in our public health response. These inequities are orchestrated by structural dynamics, ones rooted in colonialism, discrimination, and extraction. So here at EEE, our overarching goal is to raise awareness about the nexus of climate justice, health justice, anti-colonialism, anti-racism within climate and health action. So there's a lot to talk about. And we particularly value perspectives that consider power imbalances that are rooted in colonialism. We want to emphasize the power of storytelling and shifting a culture in discourse as a way to platform MAPA communities' stories and solutions, and mobilize specifically the health community's role in participating in an explicitly justice-oriented and climate and health practice. I think I went through my first slide already, so that's me sitting at the Children and Youth Pavilion. On your right are the collaborators, and my special thanks to our supporters. So I'll just kind of go straight on. So before I dive into what we did at COP and what we saw and what we learned, I kind of want to share a story about something I've been thinking about since last week. So I had the opportunity to join or to witness a really interesting panel on advances in virtual carbon markets, really technical stuff that challenged my current knowledge base around current climate financing solutions. And I had worked up the courage to approach a panelist afterwards and ask her a high-level question about climate health and justice. But when I had mentioned climate justice, I was interrupted, and she's like, now, what is climate justice? Is it when poor countries ask rich countries for money? And I was a little taken aback about how directly the concept was seemingly dismissed and almost looked down on. But, I quickly acknowledged that, yes, like that's one dimension of it, but we were interrupted because we were hurried off the stage. They were trying to get into the next session. And then I reframed my question to get her thoughts on the matter. But I think what stuck with me about that exchange was the rapidness at which the speaker had reduced climate change, like climate justice, this like really complex and central value in climate action, to simply a poor-rich dichotomy. It's not simply poor countries asking rich countries for money, it's formerly colonized nations whose developmental futures have been devastated by settler colonialism and extraction, asking for colonizers to support them in building resilience to a climate crisis caused by colonialism. I think Marina phrased it really well, is that addiction to fossil fuels. I think that addiction in and of itself is extractivist and it is colonial. And so in that moment, I was way too intimidated to say this. Hold on, sorry. I was way too intimidated to say this articulately, so I want to say it now with all of you. When I say climate justice and health justice, I mean a reconfiguration of colonial structures that fuel climate change, meaning that communities most impacted by the climate crisis, yet least responsible for it, can access materials and resources to better protect themselves from it, and then acknowledge and redefine the colonial legacy of this crisis by confronting it through public health responses that untangle these effects, and then creating meaningful, effective solutions that rebalance power. So when I say climate and health justice, I mean us as a collective health community. We need to imagine the systems and practices of healing that confront extractivism. As my colleague Abby Devnayagam talks about, addressing the systems of sickness that need to be addressed if we want to improve health. And we do that by specifically tackling power and colonialism in our work, storytelling, and mobilizing the health community. So a little bit about our goals and objectives for COP. So we wanted to advocate for an anti-racist, anti-colonial approach to climate and health justice at COP27, and specifically within the health community. And we wanted to raise awareness about the issues of racial justice and climate and health in the climate and health justice movement. So these two are really closely related, but I think they're distinct in that advocating for these approaches in climate and health justice, you really want to expand that part of the small corner that we are in climate and health, and really push for that justice-oriented approach. And then more broadly to the delegations around us, raise awareness about why racial justice and anti-colonialism is relevant to the climate and health justice movement, and how we can kind of tackle them together and not just let climate justice fizzle out as kind of a hotkey term. And then finally, amplify young MAPA narratives on this nexus, so that we can really highlight the colonial habits in our public health work that kind of reinforce the systems that make us sick, but also tackle the greater issues such as that addiction to fossil fuels, such as the extraction that we experience that create things like displacement, like an unjust food system and food apartheid. Okay, so what we did at COP. We did a lot of things. We were supposed to hold 3 events, but unfortunately that last one at the very end of on the 18th, the last day of COP, had to cancel because illness was rampant at COP27. But we managed to do two. So our first was capturing climate and health justice using film and mappa stories. So we invited a panel of filmmakers with a dedicated interest in health justice to talk at the first ever Children and Youth Pavilion. These are all young activists, young filmmakers, young people who also are medical students, who are clinicians, who are lawyers, and who are activists. They talked about how film can not only capture the complexities of the systems that create climate-related ill health, because when we think about ill health, we think about this massive transdisciplinary experience, and you experience health. How to kind of convey that to people. Storytelling is a great way to do so, and storytelling for health and climate has been really effective for them. But they also talked about how filmmaking can help humanize the issue. In a lot of their communities, they talked about how a lot of individuals feel distanced from the crisis because the way it's taught in schools might be focusing on the polar bears and the ice caps, or they might not actually relate it to the experiences that are happening on the ground, and that the examples in climate education, mainstream climate education, don't really envision it as something that's relevant to them. And so local stories, local films, and like local culture can really help ground that and humanize it for people facing the worst of the climate crisis effects. And then on behalf of UCL, we hosted an official UNFCCC side event on how health systems can adopt justice-oriented approaches to resilience building. So in this discussion, we had the pleasure of sitting with high-level policymakers from Nigeria, including including researchers in the UK and Sri Lanka, where we also discussed how financing for health justice is a requirement if health communities in the global South are able to ramp up for the intensifying effects of climate change. We talked about equity, rebalancing of power, but also how to combat things like the brain drain, which is facilitated through colonial habits, the importance of governmental accountability in meeting these needs, fighting for climate financing, and how the imposition of things like the fossil fuel industry and other extractive industries kind of, again, impose on the health system's ability to facilitate health services, and how they need to be called out explicitly if we are to build truly justice-oriented climate resilience health systems. So these two sessions should be available online. I know that Pathways to Climate and Health Justice definitely is, but I'm still looking for the Children and Youth Pavilion one, which might take a minute. While we weren't on these events, we were connecting with people. We were connecting with the health community. We were connecting with young climate activists at COP. We interviewed delegates for an upcoming race and health podcast on the expansiveness of climate and health justice discourse at COP27. We also shared our work with policymakers and nonprofits to help advocate for decolonized climate and health justice education, platforming mappa stories through film, and we even did some research with the Lancet on the role of racial justice and anti-colonialism in combating climate change within the health community. So we did a lot of talking, we did a lot of networking, but I think the best word that I can use to describe it was connecting, especially with other young climate activists and finding out what they're doing on the ground and how we can support their work. We also held a session at the International Child Health Group's Winter Conference while live at COP27 to discuss that decolonized climate and health education and kind of distill themes relevant to our work in climate and health justice. So that's a bit on what we did. And then what we observed. Let me just check the time really quick. Okay, I'm a bit over. Okay, real quick. Health is a small corner of climate action. We know this. And climate justice, so one that takes anti-colonialism and anti-racism, is even smaller. And so we really wanted to do is kind of amplify that corner of this discussion. We heard that health used to reference the urgency of climate change, but external to the health system, those references lacked health solutions, and even more so, they lacked solutions that would redress the colonial habits and structural dynamics of the issue. And we would like to see more on that front. I see Anthony popping up on my screen. Is that the 1 minute warning, I assume? Okay. I will skip. I've harped on colonialism quite a bit, so I'm going to say on this is the IPCC report cited colonialism, and that's a huge win, but we really want conversations to really imbue that structural dimension of things, institutional dimension of things, and really like go forward with the justice argument. Financing needs to then build on that anti-colonial space and question who has access, why do they have access, and how is financing being facilitated. It's great that we have a new fund. It's great that we have increased commitments, but how are those commitments being disseminated? It will be critical in making sure that we actually see the health outcomes that we want. And so before I close off, I'd like to encourage the participants, from what I understand, these are fellow young or early career researchers interested in climate and health to think about these things, but in your studies, think about evidencing. So when we think about evidencing specifically here at UCL, we play a really important role in promoting justice in our work and in our research and how we hold ourselves in climate and health. So when we have to think about how, okay, I don't want to take up too much time. I'm just going to close off here and leave it to the questions to give my spiel on evidence, but thank you for hearing me out.
Mita, thank you so much. And, you know, people underestimate the power of stories, and that's certainly what the media focus on. Marina, Mita, stay online and perhaps turn your videos on, because we're going to have some interesting questions now. I've got a couple of really interesting questions, first of all, about COP, because I don't know if this works in the chat. I'm just going to put in, can you see the chat, you guys? Most people, because I put in the, there was a Guardian article by a retired UCL professor called Bill McGuire, all about the COP from 2 days ago. So that I've got the link there. If not, just type in Bill McGuire Guardian and it will come up. It was interesting because there are people who are quite pessimistic about the future of COPs. And if you're not, after 30 years, actually talking about the main cause of emissions, you know, we haven't got very far. But 2 questions on the COP, probably, which I'll start with Marina. One is, what does COP27 tell us about the effectiveness or ineffectiveness of global governance and intergovernmental organizations in solving our biggest challenges? And I'll chuck in the other one as well, which is, that was from Rachel H. And there's another anonymous one. Will the agreement of compensation during COP to developing countries from rich countries offset the burden of climate change and its disproportionate impacts? So is that going to work? Perhaps Mita will have a word to say, a word or two about that. But anyway, Marina, how good is our global governance?
That's an excellent question. I think it's as good as global governance gets in every dimension. The UNFCCC is based on consensus, and that has enormous strength in that everyone has to be on board. We all have to agree and commit to doing this together. And in tackling a global crisis, you cannot do it in isolation. So it's a very powerful mechanism to bring people on board and ensure that we're all on the same page and we all collectively agree on doing this together. So that is kind of the beauty of it, and that is what underpins most UN processes. Obviously, this year was quite telling in terms of whether these negotiations worked or not. Last year, we had already seen Alok Sharma almost in tears when the language of the COP26 negotiation was watered down. We had language saying that we would phase out unabated coal, and then that was watered down to phasing down unabated coal. Or even the unabated word was put there at the very end. But that was a consequence of probably consensus and the fact that we had only mentioned coal, not all fossil fuels, and India felt attacked in their main industry, and it was unfair that not all fossil fuels were there. So even in that watering down of the language, there was a lot to say about how we build consensus and ensure that everyone agrees on doing this together. and how to make justice ultimately. Because
don't you think unanimity is a recipe for inaction? Because isn't it true that actually at Paris, when they really did get some serious commitments, that at the end of the day, the big countries all got together and were finally agreed, and then they just slapped down and ignored some of the smaller countries, because that's the reality of the real politic. The problem is if you have, one country or three countries objecting, particularly petrodollar countries, they're going to sabotage the whole conference at the end, which is effectively what happened.
Yeah, and that is kind of the other side of consensus. So on the one hand, you get everyone to commit to the same thing and doing this together. On the other hand, I think it was Damien Carrington, the environment editor of The Guardian, that in his article said that the big petrostates were holding the world ransom because of that consensus requirement. Basically, they put what they call a red line, and they say, if you ever mention fossil fuels, then we don't agree, and the whole thing collapses. And what happened in this COP was that we had precisely that ransom process going on. At the same time, we had a major win in terms of climate justice. That was the agreement to develop the loss and damage fund, whereby countries most affected would be compensated or helped in terms of resources. And that was an enormous win that we couldn't give up on. So they held that win to ransom to avoid mentioning fossil fuels. And that is where the negotiations fail. And one of the things that, if you've read in the news, was really evident this year is the enormous lobbying from the fossil fuel sector. So that's what we say, even today, our health is more than ever at the mercy of fossil fuels, because it's the fossil fuel sector that is actively blocking any progress towards meeting a healthy future.
Okay, Mita, in terms of compensation and this loss and damage, I mean, they've agreed to set up this fund, but there's the devil's in the detail. Are rich countries going to cough up? Is it enough to go to countries? How's it going to be spent? Is it just going to be ripped off by various middle people or corrupt governments? There are lots of issues in all of this. And whether as climate change progresses, as it inevitably will, whether this money is going to be enough. Any thoughts?
I think you're absolutely, you're hitting the nail on the head. The devil's in the details. And I think from my perspective and what I know about funding, and specifically from the global health side of things, it's always, yes, there's money made, but who are the applications going to? Do they know how to apply for them? Are there training schemes that are increasingly and expanding access to individuals, specifically local organizations who harbor the knowledge of how to tackle this crisis on their own terms? Can they apply for them? It's about what projects get funded. It's about the evidence that it is needed to prove effectivity, and then it circles back to potentially epistemic justice and the ways in which evidence is valued and kind of considered for funders. So it's a really, even at this baseline, there are already concerns about that. And then if we take a look at more money being given, which is, I think, really important, and it is a huge win that it is given, how is it being facilitated is the question. And why haven't, to what extent have the concerns even prior to the fund been considered by places like the Green Climate Fund, who have been notorious and expanding, but also making sure that there's a really narrow access to the pool. Someone on our panel, yeah. Just
on, I mean, the Pakistan flood is now estimated to have cost the country $40 billion. And it will probably be more than that, which is 12% of their GDP. That's a massive hit. And that's happening now at 1.1 degree of warming, a third of the country underwater. I mean, it's just going to get worse, and how we can do something about that. There is a question, by the way, to you, Mita. Somebody has just said, you mentioned a podcast. Where can we listen?
Yeah, so the podcast is called the Race and Health Podcast. I'll pop the link into the chat if that's all right, but you can find us on @Race and Health on our social media. But I'll give you more information in in the chat.
Okay, thanks. Look, there's a couple more which relate to this whole governance issue. So Olwen, M. Olwen, has said both presentations point to structural issues. What can we do to alter systems that still favor dependence on fossil fuel and extractivism? I mean, we all depend on fossil fuels. We've all benefited from them. How do we make this change? What are the systems that are really going to bring about the change we need rapidly? And another anonymous question, how can we put pressure on our leaders to promote green policies? I really respect disruptive protest and stunts, but it doesn't appeal to me personally. And I think that's one of the issues, that a lot of people feel helpless. And that's another question from Jane White. COP can make us feel helpless at home, the general public. What are the tips for the best positive action we can take at home and in our daily lives? Let's start with the green policies and systems, and then we'll come on to individual things. Marina.
That is kind of the key of the question, right? How do you transform the system when you don't have international governance that helps push in the right direction? The most obvious answer is the UNFCCC does not define the bottom line. It gives excuses not to increase action, but does not define the bottom line. So there's a lot that countries, and particularly local systems, can do in terms of transforming the way that energy is produced, consumed, and everything else is consumed, really. So that kind of links nicely to the other questions. There's a lot that we can do as individual citizens in terms of putting pressure on our governors, our local policymakers, and in taking individual action as well. I think it's important, though, to note that not everything goes down to the individual level. But if it comes to what we can do as individuals, first, voting, second, reaching out to your MP or whoever your local representative is if you're in a different country, and requesting that some changes are made, particularly in terms of how cities are structured. There's a lot of emissions that come from the way that we behave around cities, the way that we use transport systems, the way that our buildings work, the way that we are consuming energy. So there's a lot that we can do at a local level. And the power of local action also means that we can ask for much more interactions between different systems in government. It's much easier to get local authorities to put the environment representative to talk to the health representative and have an aligned response to economic, energy and climate crisis at a kind of city level or at a very local level than it is to do it at a national or global level. So action can start bottom up, and good examples go a very long way in putting pressure on other systems. And when it goes to the individual level, there's a lot of decisions that we can take on a daily basis. And that is where health becomes so important, because when we choose how to travel, when we choose what to eat, when we choose how to warm our homes, we're making active choices, not only for our environment, but also for our health. And that is where the win-win situations can come along.
I mean, finance lies at the root of an awful lot of this, the global finance system. And we've always had a rule that, you know, the polluters must pay. And carbon polluters have never paid. They're subsidized. There's massive subsidies still going into fossil fuels, both direct and indirect around the world. And the carbon price is effectively zero in most countries, or less than zero. It's a negative number. So we've never really got those structures right. And there's been a huge reluctance. But we've now got a situation where renewables are cheaper than fossil fuels. And, you know, because of Ukraine and Russia and stuff, we've got this big energy crisis right now. Could this be a tipping point where financial structures around the world begin to shift? I mean, like the World Bank, for example, the World Bank's come in for criticism because the director of the World Bank is considered a climate skeptic, almost a denier. And now there's been a lot of pressure there to refocus their investment in this direction. But you do need big decisions to really hammer the top 30 oil companies to introduce carbon taxes and then shift. You know, if you increase your taxation return from carbon, you can reduce income tax. Mm-hmm. And people don't kind of get that governments have a choice here, that they could do more. Mita, quick, anything you want to comment on there? And what about individual things that people can do?
Well, I am typically a big believer in structural problems require structural solutions. And I want to echo kind of Marina's sentiments about voting and staying politically informed, because this is a political issue. It's not solvable by individual actions alone. But I will say that while I have a distaste for hyper focus on individual behavior, I think there's a lot of hope in the fact that we're agents of culture and we're agents of change because of that. And so if we participate together in community action and community care, we can create a cultural shift that does influence things like the demand for funding for local action, the amount of attention placed on anti-racism and anti-colonialism. Like, I think what we consume and how we consume and why, and being able to reflect on those things in a meaningful and critical way is way more powerful than we think about. And so it might be uncomfortable, and it's very difficult and very emotionally taxing, but I think we do have the responsibility to reflect on how we participate in structural change, in addition to critically thinking about our diets and whether or not we have the capacity to limit our diets or to adjust, or how we go to work. These are important things to consider, but what do they mean for you and your capacity and how you participate in the structures that create climate change and that rely on things that create climate change, if that makes sense?
Yeah, thank you. Actually, I often use three slides that I've stolen from Professor Mark Maslin, who's professor of geography. And the first one is showing that actually we would gain something like almost $50 trillion if we made the transition to zero carbon. It's not a cost, it's actually an investment, because you get so many health rewards. And he says, he's got three overlapping circles. He says this is partly government, it's partly institutions like business, universities and the like. And, you know, we as UCL have a commitment to net zero by whenever it is, 2030, I think. And then thirdly is individuals. And he talks, and then his other slides, what you can do in each level around renewables, food systems, plant-based diets, active transport, traveling by train, flying less, la-di-da-di-da, you know, investing in local initiatives and so on. And then at the bottom, he says, you know, get involved in community initiatives and vote and protest. But there are two questions here that I think I'm going to change his slide. I'm going to talk to him, because I don't think it is just about governments, institutions, and individuals. Because Hannah Arendt, the philosopher, says power resides in groups. As soon as you remove the group, you remove power. And yeah, we have the power of our vote. I'll agree with that. But actually, a lot of things work in small groups and larger groups at community level. And there are two questions about this. This is what I'm going to finish on, actually. One is, what's in store? This is an anonymous question, for the future of community-centered based climate activism in promoting climate crisis actions, apart from the high-level policy actions. And another one, also anonymous, is, how do you think we can encourage a collective approach to climate change when many of us live in societies geared towards the success of individuals? So it is interesting, this dynamic between constantly telling individuals to change their behavior and what we can do collectively in smaller groups. Any thoughts on that? I'll start with Mita and then come to Marina.
I mean, perhaps those things go hand in hand. You know, if you want to do individual action, you also need a community to reinforce those behaviors. If we're talking about behavioral change, you need people to talk about that with and to express yourself with. I mean, this is an existential crisis. Are you going to experience that existential crisis alone? It's best to do it with community, and then starting with like where you live. And like Joy, I know in London at least, there's a lot of opportunities to participate in local, I would say, greening initiatives, but also like activist circles and people who really feel for this cultural shift, but also for like the environmental shift, like the built environmental shift, and participating in the built environment in which you live. And then I think if we can start to participate more, those movements not only become like, they might not have to be explicitly activist in nature, as I know some of us don't feel like that is our space, but then some of them do become. And so finding your space within your community is just important. That's a bit vague. I hope that helps.
No, that's interesting. Marina.
It's interesting because kind of the individual versus collective, and we're never individuals. We're always involved and embedded in some system, in some group, in some form or another, whether it is our workplace, whether it's our family, our local community, or even kind of as we become professionals in different areas in which we work, we do have certain spheres of influence. And I think it's sometimes daunting, and the individual action and the individual action can feel very minimalistic, but those spheres of influence that we have at hand can actually generate that collective action where it wasn't before. So I think it's important also to keep in mind that it's sometimes about starting a conversation or an initiative, and it's surprising how many people actually are on the same page. It's just that, as you said, the whole system is structured differently, and the whole system is structured not to enable those actions or not to facilitate those actions from happening. So it has to be a conscious decision to take to form that spaces within the communities and our spheres of influence. And I think this kind of, in those initiatives, there's a lot of resources in different groups. There's this activist groups. We've all seen Extinction Rebellion. We've all seen kind of other actions, including the Post-Nuclear Non-Proliferation Treaty, which you can sign on as an individual as well. And it's enormously powerful, even in the numbers there's power. And there's many more activist groups which you might or not align with, but they can also be a trigger for other sorts of action and other communities to be created around them from people that perhaps don't feel so comfortable, but that was the only place in which they found that resonance box to take action. So the community is growing and awareness is growing. We've seen that with data very clearly. And I think there's a lot of room for individual action to become collective.
Yeah, we're almost at time. I'm just going to finish with 2 points, really. One is, yeah, protest is great, but it's also important to harness the creative and positive outlook of people. You know, I've spent 20 years, well, more, 25 years doing working on participatory learning and action with groups in communities and with huge number of colleagues at UCL and partners overseas. We've done trials showing that you can have a much bigger impact than expected on, for example, newborn mortality in poor areas simply by mobilizing women's groups to come up with their own solutions. We've done the same. Ed Fottrell and colleagues have a big trial looking at the impacts of men's and women's groups in Bangladesh, which had a huge impact, way bigger than drugs, on reducing risk factors for diabetes and the like. And the question is, how could we use some similar approach? Can you do things at scale for climate resilience and outcomes? And we're interested at the moment, Naomi Saville from UCL has been doing a lot of work with school kids in Nepal, showing that they can use citizen science methods to collect a lot of data about hazards and their local ecosystems. And what we'd like to evaluate in large scale in different countries is whether using that information fed into communities, community leaders, taking an active approach to assess how they can improve resilience in their community and agriculture, and then, you know, measure impact, not just through sort of child nutrition and stuff, but with satellite work, looking at the improvements in agriculture, in water, in green growth, but also in soil carbon, because if you can change soil carbon, then every financial house in the world will support such an initiative because that's a way of getting carbon credits. So there's lots of stuff. There's loads of stuff going on at UCL, but we're over time. It's 5:01. Everyone's got to get home, watch the football. Thank you so much. Huge thanks to Mita. Big thanks to Marina, as ever, for great talks. And what a start to this series of public health seminars. Huge thanks to Daisy Voke, who arranged and organized so much. And thank you for joining. Have a good evening. Bye.
Thank you.
Thank you.